Hi, everyone. My name is Dr. Esiosa Igudaro, MD, PhD, and I'm here to go through some test-based questions with you with TrueLearn. For those of you who do not know me, I am currently a fourth-year neurology resident at the Mayo Clinic in Rochester, Minnesota. I obtained my combined MD, PhD degrees at the University of Kentucky College of Medicine. My PhD was in neuroscience, looking at small vessel disease and dementia. And after I finish my residency training here at Mayo Clinic, I will be matriculating to stroke fellowship at Emory. So I've spent over the last 10 plus years in the field of clinical neurology and neuroanatomy, neuroscience. So I'm pleased to be able to collaborate with TrueLearn to kind of go through some neuroscience related questions with you all so that you could do well on your USMLE Step 1 exams. And if you haven't done so already, be sure to follow me on my YouTube channel where I post several videos that go through different aspects of neuroscience, neurology, and I also give some tips for studying for USMLE, and I also host study groups as well. So be sure to follow my YouTube channel so that you can get more updates regarding upcoming videos. So today we're going to be talking about a neurology question from TrueLearn. TrueLearn is a phenomenal test bank resource that you could use to help prepare for your USMLE Step 1 exam. You can also purchase USMLE Step 2 and then neurology self-exams as needed. I highly recommend this resource. The more practice you get with studying for your USMLE test, the better you will do on the exam. So with that, we will get started with a question. So here's a question as I was going through some of the USMLE Step 1 questions, and I'm going to be focusing on neuroscience and neurology questions because that is my area of expertise. So let's start here with this question. I like to highlight as I read through questions. I recommend that you do the same when you're reading through questions for testing strategy. So here we have a 72-year-old man who comes to the clinic by his wife because of concerns for behavior. So when I think automatically a 72-year-old gentleman concerns for behavior, I'm thinking, does this patient have dementia? Does this patient have mild cognitive impairment? I need to be thinking down the categories of neurodegenerative diseases. It goes on to talk about over the last 4 months, he has been extremely impulsive and has been frequently making inappropriate comments to people when at church and other public gatherings. So last 4 months means that this is not an acute problem, nor is it subacute. This is a chronic concern. In addition, they talk about impulsivity and making inappropriate comments. So when you think impulsivity, inappropriate comments, you want to start thinking, where does this localize in the cortex? This would probably be a frontal dysfunction because our frontal cortex helps with impulse control. So I'm suspecting that whatever process he has going on is affecting his frontal lobe. They go on to say that he was previously a deacon at church, but has recently had to step down due to concerns for outbursts and sexual comments. Again, this sentence here is getting at there is a change in his personality that is not his baseline, that happened chronically. They go on to say that the wife is concerned because his memory has been getting worse over the last few weeks. So his memory is also being affected along with his behavior. So this again suggests a neurodegenerative process that's affecting both behavior and memory. So you want to start to think, what are some of the neurodegenerative processes that you know that affect behavior and memory. They go on to say that his medical history is remarkable for hypertension and diabetes. Current medications are losartan and metformin. Does not smoke, do alcohol or any other illicit drugs. Blood pressures 140/80, that is not too high. So now they go on to talk about the exam. He's alert to person, place, and time. They also talk about that his 3-item recall is normal, but patient is unable to count backwards from 100 by 7, nor is he unable to spell world backwards. So let's pause and kind of figure out what they're trying to get here at. Person is alert to person, place, and time. So this here kind of gets at orientation questions. And if someone is severely disabled, the last thing to go is orientation of self. So because the patient is alert to person, place, and time, this can suggest that maybe it's not affecting his hippocampus, which is where we store short-term and long-term memory. Again, patient is able to recall 3-item words, sometimes in these different cognitive testing that we give in the clinic, like the MMSE, Kochman, or the other testing, we give 3 words, and then we ask them what those 3 words are 5 minutes later to kind of see if the patient can remember the 3 words. And if they're unable to remember it, then it's concerning for a process affecting the hippocampus. But given that this patient is able to remember it, it makes a hippocampal process like Alzheimer's disease less likely. They get into the patient being unable to count backwards from 100 by 7. This here gets at calculation, and unable to spell world backwards. Other hints that they give is they talk about his MRI. So when you have a patient, you're concerned for memory deficits, it's always important to get an MRI to see if you see any atrophy of the hippocampus, the frontal cortex, the parieto-occipital cortex, because different neurodegenerative processes show different patterns of cortical loss on imaging. So this gentleman has atrophy of his frontal and anterior temporal lobes. And this is consistent with what I had mentioned previously, because I mentioned that he has behavioral dysfunction, and that's something you see typically in processes that affect the frontal lobe. So now they ask us the cause of the patient's symptoms is associated with which of the following. Another testing strategy I recommend is before you look at any of the options, you first want to figure out in your head, what do I think the diagnosis is? So the key neurodegenerative processes that you should know are Alzheimer's disease, dementia with Lewy body, prion disease, vascular dementia, because those are and then Parkinson's disease. Those are the big neurodegenerative diseases that get tested highly on the USMLE. So now you want to think of those 5 or 6 neurodegenerative diseases that I mentioned, which of the following could this most likely be? It's not Alzheimer's disease, because if it was, patient wouldn't be able to, would have difficulties with 3-item recall. It's not really fitting a vascular dementia type process. Blood pressure is mildly elevated, but not too high. He's only on 1 blood pressure medication. His MRI doesn't show evidence of chronic infarcts, so that makes that less likely. This is not fitting a prion disease, given that it's a chronic process happening over 4 months. It's progressive, but not rapidly progressive. And we don't see restricted diffusion in the cortical ribbon that is pathognomonic for prion disease. And Parkinson's disease or dementia with Lewy body here is less likely. He's not having any motor symptoms. He's not having any visual hallucinations or delusions that you see typically with dementia with Lewy body and or Parkinson's disease. So now that we've kind of narrowed it to this is probably frontal temporal dementia or FTD, then we can look at our options and see what matches with FTD. So option A is getting at cytoplasmic inclusions of alpha-synuclein. That fits Parkinson's disease. We ruled that out, so you can cross this out. And what I like to do when I'm taking tests, if it'll let me do it here, is I like to click on these options and cross them out as I go along, because then it helps me keep track of what options I have left. Cytoplasmic inclusions of aggregated tau proteins. That fits with the underlying pathology of FTD. Expansion of ventricles and a normal intracranial pressure. This here is getting at NPH, normal pressure hydrocephalus. This is less likely because with normal pressure hydrocephalus, you have wet, wacky, wobbly. You increase urinary frequency and incontinence, altered mental status, encephalopathy, and difficulties walking. And he really doesn't have those features, so it makes option C unlikely. Then we get to option D that talks about periodic sharp waves on EEG. And this here is getting at prion disease. So this is a characteristic finding that you'll see in individuals that have prion disease. And we mentioned earlier that his picture, this clinical scenario is not fitting prion disease, so D is not the right choice. Option E, plaque formation of amyloid beta protein, that is getting at Alzheimer's disease. And we already mentioned previously that this is not fitting an Alzheimer's disease picture because of his physical exam and what his MRI scan looks like. Therefore, option B is the correct option. And one great thing about TrueLearn is that they explain all the different options, and sometimes they'll give you really great charts that you could make flashcards out of and incorporate into your studying. So here are the diseases you should know for the USMLE Step 1: Alzheimer's disease, prion disease, also known as Creutzfeldt-Jakob disease, frontal temporal dementia, also known as Pick's disease, HIV dementia, that's fairly rare dementia, dementia with Lewy body, like we talked about, visceral hallucinations, Parkinsonism, and then normal pressure hydrocephalus, and then vascular dementia. And TrueLearn then not only gives you a really nice chart that you can review, but if you keep scrolling down, it goes into detail about why the right answer is right and why the wrong answer is wrong. And it bolds what things you should really know for your exam. And then if you want to get to, okay, what's the main takeaway from this question? I love their bottom line text that they have at the end of every single question. And then they also give some, things to think about. And a great thing is that they also give references for more reading. So that is this question. And be sure to, again, follow my YouTube channel so you can get more explanations on test-based questions from TrueLearn. And be sure to click on the link that is located at the comment section of this video if you're interested in purchasing a test bank, which I would highly recommend, because I'll be going through some more questions and you can follow along. If you have any questions, feel free to post them in the comment section, and together we can do extremely well on the neurology portion of Step 1. With that, happy studying, good luck, and I will see you at the next video.